Some of the core roles for Medicare locals are to support providers and to try and improve the coordination of care provided to patients in our region. What I really like about HealthPathways is that it does that really well. It gets all the providers, specialists, GPs and allied health providers who are involved in the care of patients with a particular problem to sit down together and work out how we're going to manage these patients in our region. It's a great process. The providers really like it, and it produces these pathways that make sense in our local area and deliver better care for patients.
HealthPathways began because we recognised that there were a number of problems in our outpatient services within Hunter, New England, and primarily based around John Hunter and our Royal Newcastle Centre clinics. So some of the problems that we knew existed were long waits for patients, poor communication between GPs and specialists, in particular inadequate information in referrals. So it made it very hard for us and the specialists to prioritise patients, to make sure that we saw the right patients at the right time.
HealthPathways brings together GPs and specialists. They sit together in the same room. They discuss the issues and the problems that surround a particular problem, such as atrial fibrillation or cardiac failure, in terms of both the workup of patients, in terms of the referral of patients, in terms of what needs to be done whilst they might be waiting for an outpatient appointment, and even some tips perhaps to do with our ongoing management. So that's probably the most important part of it, where you have GPs and specialists re-establishing a dialogue, re-establishing a connection between general practice and specialists that has largely disappeared. And this is an important and fabulous thing to have happen.
In a nutshell, I think HealthPathways provides a one-stop shop for the GP, everything that they need to know about the management of chronic pain. So it gives information about referral to specialists and also the allied health who play a pivotal role in pain. It gives information that's relevant to patients, gives management strategy that the GP can undertake, and importantly it's all localised information that's on the site and with a dynamic capability to update.
The Hunter Urban Medicare Local has been linking with the Hunter Integrated Pain Service to help educate exercise physiologists and physiotherapists to improve the management of patients with chronic pain in primary care. And through the education of these allied health professionals, we're hoping to link them then with general practitioners and practice nurses in primary care so that they can all communicate and improve the management of these patients.
Something like chronic pain is really quite complex, and it can mean that there's lots of different pathways and avenues that patients might have been down before. So the work that we've been doing with the Medicare Local and with the pathways in particular has brought all of those complexities into one place, and it's meant that different clinicians, allied health, GPs, specialists, have all got access to one place where all of that evidence-informed information and resource is accessible. So it just meant that instead of having lots of different ways to manage things, there was just one really relevant pathway that showed the best way to manage those things based on the evidence that we've got available at the moment. The really great thing about the Medicare Local has been that it's enabled a really lifelong link, I think, between the tertiary and the primary sector to bring together those health professionals who are involved in the care of patients across the care continuum. When you've got something that's complex for patients to navigate and for health clinicians to navigate, it's been useful to have someone that's really at the heart of that, pulling it all together. And I think the Medicare Local has really done that in the Hunter community.
As a pharmacist, you can often feel that you're working in isolation, particularly in community pharmacy where you're the sole pharmacist there and there are no other health professionals to liaise with. And what the Hunter Urban Medicare Local has done is bring all the health professionals together from various different allied health streams and general practice primary care and tertiary care, and get them all having a conversation about how to manage patients in the best way possible, so that in the end what we're hoping to do and what we will do is improve the health of every patient here in the Hunter.
It's really frustrating as a clinician trying to use clinical guidelines that have been developed outside of the region and to find that they really just don't work for patients in the local area. What I like about HealthPathways, it's a project where we're getting lots of clinicians from the local region together to develop pathways that make sense in the local region. If you want to be part of this exciting initiative, get in touch with us at the Medicare Local and we can work together to improve care for patients.